Welcome, everybody. Thank you all for coming. I'm Cheryl Heller, Chair of Design for Social Innovation at SVA. And we are the first MFA program in social impact design, which is the application of the design methodology to creating a healthy society and the environment. As a graduate program, we engage in lots of projects with communities and institutions to benefit them and also to expose students to the world as it is in real life. And that desire to work with communities was the genesis of this initiative. Systemic social issues aren't ever solved by a single institution or industry. They require collaboration. Our collaborators on this project are the Arnhold Institute for Global Health at the Icahn School of Medicine at Mount Sinai. They are working to improve the health of people around the world by building global partnerships in research, education, and patient care. The PopTech Institute, an organization that convenes and catalyzes an extraordinary global network of scientists, technologists, and thinkers to collaborate on groundbreaking projects in global health, human rights, and violence prevention. And Strive, an organization founded in East Harlem that now provides services that help people in many cities find sustained employment and become valuable contributors to their families, employers, and communities. So that's who we are, and I'm going to now attempt a 1-minute history of the months of work and events that brought us here tonight. It began with a class of our first-year students, all of whom are here, who come from 13 different countries, who went out to map 4 blocks in Harlem and identify what they thought might be the forces that impact health. And then a group of Harlem residents who mapped what they saw and felt from the inside. With help, the students turned their data into an interactive gallery exhibit that illustrated various categories of the data collected, like green spaces on the left, all the services available in the neighborhood, all the signs and visual communication that residents encounter, and noise pollution, and there were others. We had a reception where lots of people came to see the show. And we combined student and resident data with public data. We built a workroom to display them so people could come and discuss what they saw. We made a lot of digital maps for the purpose of illuminating data and starting conversations about the implications of what we found. This one is on housing. We did them on what fresh food was available, health services, and lots of other things. We invited a small group of designers and mappers and residents to discuss what we found so far and what they thought was missing. And last Thursday, we offered a masterclass in Harlem to teach residents the skills to develop their own data, to have their own voice, and participate in solutions. All of which brings us to tonight. This is the culmination of what we hope is the beginning of something much longer. It's nothing compared to what needs to be done, but we're committed to continue long after this evening and beyond this small group of collaborators to help the residents of Harlem live in neighborhoods that actually promote health. I learned just this morning that Langston Hughes was born on this very day 112 years ago. Obviously one of the great American poets. And so I thought it would be fitting to read his very short poem called Harlem. What happens to a dream deferred? Does it dry up like a raisin in the sun, or fester like a sore and then run? Does it stink like rotten meat, or crust and sugar over like a syrupy sweet? Maybe it just sags like a heavy load, or does it explode? So I'm extremely honored and excited to introduce our speakers this evening, who are going to talk about how we might create a healthier Harlem. And just to say in advance, the issues that we're going to be discussing are those that have emerged from all the conversations we've had with Harlem residents so far. Rob Carmona is one of the co-founders of Strive International. From its beginnings in an East Harlem basement office in 1984, the Strive model has grown to over 20 cities nationwide and overseas, and has helped over 50,000 individuals enter the workforce. East Harlem-born Carmen Quinones is Tenants Association president for the Frederick Douglass Houses. She's on the Manhattan staff of Presidents, which represents 28 housing projects and 300,000 people. Dr. Prabhat Singh is director of the Arnhold Institute for Global Health and special advisor at the Peterson Center for Healthcare. He was the founding technical advisor of City HealthWorks, which is a Harlem-based social enterprise that trains and manages locally hired health coaches to improve the outcomes for high-need patients. Cyrus Vance Jr. is a Manhattan native. He was inaugurated as the District Attorney of New York County in 2010 and re-elected in 2013. He's enhanced the expertise of the DA's office on identity theft, cybercrime, white-collar fraud, hate crimes, terrorism, domestic violence, human trafficking, and violent and gang-related crimes. And Clyde Williams has had a long career in public service that includes working for both Presidents Clinton and Obama, creating public-private partnerships in Harlem and nationally, and federal housing and food programs that affect urban communities. Clyde is a board member of the MAC AIDS Fund for programs that reduce HIV infection in Harlem. So for all of the thousands of hours of work, I want to thank our team at DSI and our faculty and students, and Gabe Schuster, who was our cartographer, Kevin O'Callahan, who designed the exhibit, Primoz Kovacic, who flew all the way from Nairobi, Kenya to conduct the master classes, Larry Jackson from Strive, and most of all, my decade-long collaborator and dear friend, Letha Filderman, who's the president of PopTech. So now, please welcome our speakers, and we will all come together on the other side of the stage. We're all excited to have a group as diverse in perspective and experience as this one. So I would love to ask each of you to talk about your particular definition of health and your perspective on what community health is. And we're going to start with ladies first.
I'm always put on the spot. See that? The only lady here?
Hey.
All right. My name is Carmen Quinones. Health is a big issue here in the city. I sit on Metropolitan's board for the auxiliary and patient advisory board. And so we know that when people come into the hospital, they already come with anxiety because they're not feeling well. So it is our job to make them feel a lot better. I represent almost 300,000 people sitting on the board, and these are all NYCHA developments. So as you know, we have a lot of issues in NYCHA. So I don't want to take too much time with that, but there's a lot to be said.
All right, Prabhat?
Great, thanks, Carmen. Thanks, Cheryl. So my name is Prabhat Singh. I'm a primary care physician, and I work here in Harlem in New York City. I recently joined Mount Sinai Health System after being at Columbia University for about 4 years at the International Affairs School, where I thought more about global issues in health and healthcare. And after living for 4 years in Harlem as I trained to be a primary care doctor, it really became evident to me that I needed to shift my work and recognize that that global that I was looking for was actually here in our own communities. Over the last 4 years, I've learned an immense amount working with community health workers, people from the community who are trained to motivate the people around them, to help improve their ability to set goals and achieve them in ways that improve their health, improve their life. And in many ways, I learned that there's a two-way street between how healthcare is designed and delivered from the perspective of a physician, and how it's received and interpreted on the side of my neighbors in Harlem. And through that process, as I started to shift to Mount Sinai Health System, in the context of a unprecedented dynamic healthcare environment, where in New York State alone, the state is spending $8 billion to redesign how it cares for low-income New Yorkers, in participation with about 200 community organizations in Upper Manhattan and across the city. I realized that we really needed a way to make sure that this input and the perspective that you see when you talk to a patient, when you speak with your neighbor, doesn't stay just in their minds. We actually find ways to scale that up so that there's actually a design interaction that helps us think together in more constructive ways about how do we build not healthcare systems, but healthy communities. And in many ways, that means that even as a technical expert, we have to kind of recognize that we have limits, and a lot of the people around us have those solutions. It's both a really exciting place to be. It's also incredibly humbling, in part because, as Cheryl mentioned, there's no industry that's able to solve complex social challenges alone. And as I look to my colleagues that lead housing institutions or lead institutions that are at the head of the safety of of New Yorkers, I think every one of us grapples with the fact that you can't do this alone. And so we're always looking for ways to design better and to design in larger foras. And it's been incredibly exciting, and it's been really fortunate for us over the last year and a few years to start to learn the methods to give voice to start a map, and start to interact at a much more constructive level with the communities that we say that we're serving.
Good evening. My name is Clyde Williams, and I'm glad to be here, and thank you guys for organizing this event. When I think about healthcare, I think about something my grandmother used to say to me all the time, that you don't even think about your health until you have to think about your health. And when I think about what healthcare means, to me, it was always something I thought about as a national issue. As a person who had the ability to work for President Clinton and for President Obama, I was one of the people who went across this country pushing the healthcare initiative program that was institutionalized by this president that we have now, Obama. The Affordable Health Care Act is a tremendous piece of legislation when you think about it. Every president since Teddy Roosevelt has tried to do something around health care, and he is the only person who got something done. When I think about health care, I think about the fact that millions of people now have health care who didn't have it before. I think about the fact that people who are 27 and younger can stay on their parents' health care policy for years now when they couldn't do so before. But I also think about how it changes us as a society. I think about healthcare as being a national security issue. Without having a healthy group of people, an educated group of people, we cannot be competitive with the rest of the world, and it's something we need to be aware of. When I think about healthcare, I think about Harlem specifically because I live there, because I'm raising my children there. I think about the fact that 30% of the people that live in that congressional district live at or below the poverty level. I think about the fact that every single day there are people all across that district who are worried about healthcare issues, particularly mental health care issues, which is something that we do not talk about that often in Black and brown communities that we need to have a real conversation about. I think about the number of kids that live in poverty, that are struggling every single day to figure out where their next meal is going to come from. And so when I think about healthcare, I think about what it is we can do as Prostate collectively to bring about real change in our community, to do something profound. And one of the reasons why I think that this initiative and this program is so important, because as was said earlier, it's not the beginning, it's just the first process of doing something that we believe and hope that we can be a part of to bring about real change in our community. So thank you for doing this.
My name is Cy Vance. I'm the Manhattan District Attorney, and I was elected to be the Manhattan DA starting in 2010. And I'm so pleased to be on the stage here with people I know and have met before, and who are just fabulous New Yorkers who are making our communities much, much better. And so I'm grateful to be here. When I think about this issue, I think about it a little bit like a doctor, which is not like how I would have thought about it 30 years ago when I was a young assistant DA. I think about safety as something that we achieve, obviously related to health. We all want to be safe and secure in our streets. But very much on top of the work that we do in what I'll call enforcement, which is investigations and prosecutions, which are very important and which make a huge difference. I also very much appreciate the importance of preventative steps in crime prevention, just like a doctor would be trying to figure out strategies so that you stay healthy so you do not get ill. And I think we could all, if we all looked around ourselves and asked ourselves this question, which would you prefer, to prevent a crime from occurring or prosecute a crime after it occurred, we'd all say the obvious answer is we would want to prevent it. And we would want then to invest in strategies that would be able to penetrate into communities, whether it is young New Yorkers, whether it is seniors who are at risk of being preyed upon by so many people, whether it's our immigrant community. And so while I think our office really does a phenomenal job on the hard-hitting side of prosecution, I think we have become much more engaged in preventative measures, and that also includes people who are in the criminal justice system, really making sure that we are intelligently making decisions about who should come into the justice system and who shouldn't, because even people who come into the justice system very often are, the opportunity is there to have an exit strategy for them so that they are not negatively affected with employment and other things that some of us take for granted. So law and order is very much part of health in our communities, and I think it's becomes a part of health in our communities in ways that are very different today than it would have been when I was a young assistant years ago.
Hi, my name is Rob Carmona, and I'm co-founder of Strive, as they said earlier, and quite frankly honored to be here. Even though by training I'm a social worker, and in the social work profession, the niche I really fell into was workforce. In a lot of respects, this is very personal for me. I was born in East Harlem. I don't want to date myself, but the building I was born in is no longer there. But I was born there. And when I came back to the community almost 30 years ago and had the opportunity and privilege to work in the Harlem community, East Harlem specifically, for me, and it was just part of my lifeblood and DNA that I was coming back to do something in our communities. I'd never thought about health insofar as how employment impacted it. It wasn't until when I met with Prabat Singh and we started talking, it intrigued me, and I thought about all the clients that come through Strive that ostensibly come in and say that they're there to get a job. And for the most part, that's true. But what also was apparent that they were coming in with mega health issues, whether it was diabetes, asthma, and the like. But also, and Clyde just mentioned it, the mental health issues that poverty brings upon us. And I started to think about health from the standpoint of indicators of poverty. East Harlem has one of the highest incidents of asthma and diabetes in the country. And though we are now located on 123rd in Lexington, we started the organization in the basement community center of a housing project. And noticing as I walk through Harlem, or East Harlem, you'd see a heck of a lot of people in wheelchairs or those motorized carts because they have amputations and the like because of the prevalence, the high incidence of diabetes. Now where we are located in Taino Towers, there's a strip of stores right under the building that we're located on. And a lot of people with mental health issues or substance abuse issues congregate there. And I would say, I'm probably making this number up, but not by much, but at least 20% of the people that I see there are, ostensibly you could see that they have diabetes, asthma, and you could see the health issues. clearly, when we try to get individuals jobs in the private sector, we look for employment opportunities that have health care come with it. And I think that, health care is something that I certainly took for granted. There's a commercial, I don't know if you guys have seen it, where there's this black guy whose face is hidden. And it's really a commercial about his credit rating. But he starts it by saying that he had some kind of health issue. And as a result of that health issue, he went into debt. And I thought, even though it's about repairing your credit, the irony was that I don't think that people that are watching it were really seeing that he got there, and he said it by having an illness. Now, none of us wakes up on Monday and says, gee, I feel like being sick today. We get caught out there, get caught short, we're surprised by it. For me, it's important, I think, that this country move towards seeing health as a basic right and not a privilege, number one. Number two, that we develop the metrics and indicators and language that really shows the connection between poverty and illness. If you notice, most poor communities, and we've replicated Strive in a number of cities around the country. But anywhere you go in a poor community, there's always a university adjacent to it, like Columbia, right, or a hospital. And you say to yourself, if these institutions are in those communities, what's up with that? Why aren't those individuals in the communities really accessing that? Now, I'm not faulting the hospitals or the individuals. I think that there has to be an educational process that goes along with it to enlighten people that may be experiencing, poverty or just plain poor, for them to understand how that's all connected. And let me just finish by saying that one of the things Strive has gotten into is training for the healthcare community. I think the front line of improved health in our communities is going to come with some of the young men and women that are here from Strive and HANDS. It's going to be those young folks that are going to be our front line for a healthier community. Thank you.
Great. One of the things that came up a lot in discussions we have is that conversations like this always or often become a litany of what's wrong in a neighborhood, and it just serves to sort of cement a stigma about a neighborhood. So I wanted to ask some of you to talk about what's getting better. And Sai, I think particularly interesting to hear issues around drugs and crime. What is the status, and how's it going?
I think that let me start by, for those of you who are old enough to know what New York was like in the 1980s, certainly in Manhattan, crime is not at all what it was back then. So long term, we are doing better. When I look at crime now in Manhattan, I think that the big crime indicators, homicide, rape, robbery, grand larceny, many of those have been going down. You'll get upticks for a period of time, but I'm confident, generally speaking, that we are not going back to the old days, that we are making forward progress. I'll just tell you that when I was an assistant DA in 1982, there were 600 homicides in Manhattan a year. In Manhattan, in the year I took office, 2010, there were 70, and last year there were 40. So that's just one metric, but it's a decline that is startling when you consider what a significant reduction is. For me, I feel that we've made significant progress, particularly on gang violence in Manhattan. I've made an effort to use technology and all the tools we have to make sure that we are interrupting gang violence, we are identifying gun traffickers, and we are indicting and charging those people who bring guns in our communities, and we've done many, many of those cases. And we've taken out many gangs over the last 6 years, I think 17 in various neighborhoods, and I think as a result, those neighborhoods are safer. But it is really always constant vigilance. The minute you think you're in good shape is when you need to be worried about what you're missing. So just like a doctor with a patient or any of us up here, we can't be satisfied and rest on our laurels for more than a second, because if we do and take our eye off the ball, things will happen. But for our crime, for particularly our enforcement actions, what I'd end with saying is that, in line with what I said to begin with, it's not enough just to take the beach, which is to eliminate violence or gang violence in a housing project. We've got to keep the beach. And by keeping the beach, you have to work with people like Carmen through her tenants associations and make sure that the community knows that it's not just what we take out of the community that matters, it's what we put into it. And that's what all of us need to be doing.
Carmen?
Yeah, I wanted to piggyback and off of what Cy Vance was talking about. The NYCHA developments were in an uproar. I found myself hiding half the time upstairs and making phone calls from upstairs. So I don't care who knows. I will call on you. But we have, especially in Douglas houses, it was bad. Seniors couldn't come out after 7 o'clock. If you were coming home, people work late, come home late. 3 o'clock in the morning was like, you better count your blessings if you make it upstairs. But the gang violence has gone down so much. It's a pleasure to be in Douglas houses once again. And I have to say that, the PSA 6, PSA 5, PSA 4, they have done tremendous jobs when it comes to NYCHA developments. And again, a lot of these issues, have to do with mental issues also. And we need to look at that. That crime has a lot to do with mental issues. People not having apartments, nowhere to live. People trying to have something to eat. We have so many different issues, and this again affects their health. And as long as they're not getting the health care they need, they're out there doing a lot of things that they have no business doing. And we, as a community, we really need to start reaching out to them. Let's stop being afraid of our children, because most of them are children and teenagers that are out there. And they're longing for someone to say, come on, let me help you out. I have been blessed and fortunate to represent the NYCHA developments, not only as a Democratic district leader, which I was before, and a state committee woman, but now as a TA president. And I also sit on the Manhattan South board of the council. And these things are very much alive. Mental health is a big issue. We really all need to, when it comes to health, we need to look at mental illness. It's a big issue right now.
I think Rob wanted to.
Yes. One thing that I neglected to mention, because I had a career downtown. I was a funder at United Way and all this kind of stuff. And when I joined two individuals to put Strive together, I remember coming back, and it was winter when I was off the job, and like early spring when I started. But one thing you all know, that in the spring, and you go to neighborhoods, whether it's East Harlem, the South Bronx, West Harlem, Bed-Stuy, those neighborhoods are so alive. You see kids running, playing, and for me, I remember saying to myself, this is where I'm going to retire from. There's an exercise that we do, put a lot of our clients through, called the 5-minute interview. And one of the things that in that exercise, you speak about something about yourself. And invariably, you have people that speak about the challenges they've gone through in their life, whether it was foster care, abuse, the criminal justice system, you name it. But here they are, still trying to get their lives together. And what always amazed me, right, no matter how challenged the individuals were, they still had the strength to want to move forward. There is a strength in our communities that we blow past, And there were times where I would hear somebody speak, and I'm like, wow, I'm just surprised you're even alive and breathing, much less trying to go here and get a job. And, all of that, to me, ties into the health piece because so much of our health, whether we acknowledge it or not, has to do with the attitude we feel and the way we approach life. Not to say that you can psych yourself in the cure, but it certainly has an impact on how you go about making sure that you're as healthy as you can be and to pass that on to your children. And a community like East Harlem and Harlem in general, it's so alive and there's so much strength and resilience there that it would shock the larger population.
I believe one of the greatest assets and one of the most positive things about the community, again, are the people. Look at all the things that Carmen and others who are head of these tenant associations go through to get additional resources for people in the community. We were together recently when we were highlighting the issue of food insecurity. And you saw the number of senior citizens that came down from her building for food. We went across from various places, from East Harlem to Washington Heights, Inwood. Again, this is a huge issue. But yet people out there doing things to try to help their neighbors. I look at individuals like Rob Carmona, who's dedicated his life to trying to make certain that people within our community have a better outcome. I look at Cy Vance, who's been working on the kind of programs that actually keep young people out of the criminal justice system, which I think is an extremely important thing. Or when I look at Dr. Singh, who is not just a good friend, but a person who has made it his mission to make certain that Mount Sinai does right by a community that they are a part of. And so those are the kind of things that give me hope, the kind of things that make me believe that we will have a community where health is better long term.
Prabhat, I have a question just for you. Oh, well,
Rob wants to say something?
yeah, but I have a question for him.
My bad.
No, it's okay.
Go for
Pushy
it.
women, right? So a lot of people talked about the fact that this neighborhood is not missing health services, right? And yet the results are poor. Can you talk about why you think that is and whose responsibility it is to do something about it?
Boy, what I kind of cut to the core.
Yeah.
It's when I was sitting at Columbia as a professor, just kind of looking in to Upper Manhattan, I remember being so struck by the fact that we have 5 or 6 of the hospitals that you'll see on U.S. News World and Report Best Hospitals within about a 5-mile radius that ring around it. And let me just put some numbers to that. That's about $10 billion of revenue that flows through these hospitals. There's enough beds in all of these hospitals to house every 20th resident of Harlem when we talk about housing. Just in my system alone, we have 40,000 employees. And so just the scale and magnitude of these systems with a world-class, world-known public health department just doesn't add up when you start looking in the kind of epicenter and you start hearing what Rob mentioned at the opening of our asthma rates and our diabetes rates. But I want to cut to something that Cy said to kind of tie that together. I remember reading a book called In Search of Respect, which is a kind of an ethnography of Harlem in the 90s, 1993, not that long ago. And the author describes an entire building, a tenement housing, burning down, all the way down slowly over the course of days. And there were people in it. There's not an ambulance that came by. There were no services that came by because people thought it was too dangerous to even go there. And cut to 2 years ago when there was an explosion in East Harlem. Does everybody remember that? There was a really tragic explosion, which briefly made national news for a number of reasons. But you saw such I think there were 43 units, police units on board. There were multiple precincts. There was the, fire departments, health systems. There was incredible community organizations that came out. Politicians were present. There was an incredible outpouring. And I just want to put between 1993, 2013, 20 years. And in that period of time, we've just started to, first of all, understand that big gap of what's happening inside this, where we have the periphery of all these healthcare resources. We're just starting to build the basic systems to understand what are the assets, what is the strength that Rob speaks about, how do we even design in this context? So you may say this has been going on for 50 years, 100 years, this is a long story, but it's in some ways not a long story, and we're just starting to kind of understand. And so I'll just cut to why is there a disconnect? It's because we haven't put the effort into designing for connections. And as Clyde mentioned, with the work that him and a lot of colleagues did to get the Affordable Care Act up and running, we really shifted, healthcare systems have shifted their mode to thinking more about how can they be more continuously present in communities. We're thinking about prevention just as Sai's talking about prevention. We're thinking about it in much more long-term and engaged ways. I'll give you one example. You know the the paramedics that come around all across the neighborhoods, they're out in force. You know, we started asking ourselves, what if they could do more? You know, what if we train them up? They're smart young men and women. What could we be doing to actually have them be able to provide not only a little bit of care, understand what people are going through, not always pulling them right back into the emergency room. And these are just the sort of little tweaks that you start to see happen all across the neighborhood where people are trying things. They're trying to push out, they're trying to shift the gravity of where healthcare sits back into community settings through 100 different ways. I can keep on naming them, but I won't. But the point is that this is kind of a renaissance of trying to figure out how do we do this? The straight answer to Cheryl's question is there's a disconnect. We're not doing our job if we don't figure out this connection. And you know, the people that have the diagnoses are not the physicians, but people like my neighbors. And that changes how we manage the problem. And that changes our role in a community.
Great. Carmen, did you want to?
I think that, you know, especially even in the healthcare system, a lot has to change. A lot, you know, I mean, I sit on the board in Metropolitan Hospital, just to know how to treat patients. You know, a doctor needs, I mean, I've had my doctor for 27 years, right? And all of a sudden my doctor left. He wasn't getting paid enough. Okay? So I lose a doctor for 27 years. I have lupus. There's days when I get up, I can't get up. You know, and these are the things that patients are going through in each and every hospital. You get attached to one doctor and you lose them. You have to start all over again. And these are the things we need to really be talking about. Because when I had my doctor, I talked about everything and anything. When I got depressed or when things weren't going right, you know, and you know, having a doctor is just more than just having a doctor. It's having a friend. And I think that we need to really start focusing on, especially in the hospitals, on how to be a friend too, so that you can know who you're treating. You know, that's really all I have to say about that. But I think that, you know, a lot of us, you know, and a lot of people stop going to hospitals because of that. Because every time you go to a hospital, you have a different doctor. You never have the same one. You know, and that goes on. And not only mentally, that's exhausting. You know, when you have to start all over again. You know, for me, it was horrible. You know, and so I'm just saying that in the healthcare system, we need to start treating people as such. People with feelings, you know, and people with problems, because we have problems when we go to a doctor.
Yeah. Another thing that came up really consistently is the change in the neighborhoods and what's lost, and through gentrification in particular. I know you have a point of view on that, and I'd love to hear Clyde.
Boy, do I have a point of view on that. So, now, at the same time that we do understand that cities operate on tax revenue, right? And neighborhoods like the South Bronx, South Jamaica, Bed-Stuy, Harlem, East Harlem, needed to bolster up their tax revenue, right? And so we welcome new tenants coming in that that could add to that. That said, my concern is what is happening to the individuals that have lived there all their lives. Where there's a path mark on 112, I was just telling Cy about this. There's a path mark on 125th in Lexington. Now, prior to that path mark going up, you either had to go to the path mark way down by the South Street Seaport or literally that far. So you had to have access to somebody in your family or friends that had a car. It was like a food desert. So now they did this path mark. That path mark has been sold to a luxury developer that's going to be putting up a luxury building where apartments are going to average $6 million. What I say to myself is, who are these people that can afford that? There's another development on 124th and 3rd that went up about 5 or 6 years ago, and the average went there for a 2-bedroom apartment was $3,500 to $4,000 a month. So what you had is 2 or 3 students from Columbia University buddying up and living there. At the same time that we welcome new folks coming into Harlem, we also have to be mindful of the individual that live there and the stress and mental health services that they're going to need. It's pretty taxing to be walking through your neighborhood and you see somebody, pull up in, call it, a Benz or a Rolls, and it's legitimate, right? And you're and it's legitimate, right? And you're still there, and you're like, that has its impacts on individuals. For purposes of transparency, I'm older than most people in this room, and I went through 10 years of in and out of jail, heroin addiction, and what have you. Where Clyde lives now, right, which is a nice development, when I was coming up, that was a bucket of blood. I'm like 116th and 8th Avenue, that's where I went to cop, where I see people living and strolling through the neighborhood, maybe young blonde women with walking pooch dogs through things. I'm like, holy smokes. I mean, it is so amazing.
A lot of them here.
Right, and it's cool, but it's amazing to me that transition in the last 25, 30 years. So we have to be mindful as they go through that we do something to keep people that live there and are committed there still living there, and that they have the mental health supports to deal with the change that's coming into their community.
So what can be done about that, Clyde?
Well, let me piggyback on what Rob said. It is an issue. Gentrification has been an issue for, I think, decades throughout New York City. You can go from Hell's Kitchens to other neighborhoods, and you've seen that transition. One of the most stark things that Rob talked about is where that path mark was located, now that it's closed, and you're putting up condos at that price range. It's not for people who live within the community, that's obvious. But I do think that where that starts is that we have to have people, and I really mean this, who are going to be committed to making certain that those people stay in that community. And that comes from the leadership that we have within the community. I commend Mayor de Blasio for his push on affordable housing. But I also know this, that when you talk about affordable housing in that neighborhood, a person making $65,000 a year is not the average person that lives in that community today. And I think if we're going to have a real conversation about affordable housing, then we need to figure out how it is we make certain that the people who live there now also have the ability to stay and buy in that community. When I think about the fact that rents have increased more than 90% in a 10-year period in Central Harlem, 75% throughout New York City in a 10-year period, and 60% in the Bronx in a 10-year period, something is wrong. And again, Rob was saying the building I live in, I know several people who live there who are senior citizens. You're talking about women, as Rob said, who live there 30, 40 years. And now they know that, if something happens to them, because some of them are paying $300, $400 a month rent, that if something happens to them, they're not going to be there, and their family is not going to be living there anymore. And those are the people that I'm gravely concerned about, because gentrification can be good because you want more resources, you want things that help a community improve, but it should not be a process that pushes people out of a community they've been a part of forever. And I think that is the fight, and figuring out that balance is going to make a profound difference in making certain we have a community that stays diverse in reference to its ethnicity, and in reference to the income levels that are there.
So I have two questions for you, although feel free to comment on that. So we had a group of 8th graders. I think this is the easy question.
Okay.
They want to know who's watching all those surveillance cameras.
Yeah, I want to know too, Si. I really want to know.
Well, it's a great question. And I understand that, I just understand the general disquiet people have thinking they're being videotaped. In lower Manhattan, there is a literal cascade of cameras. I don't know the number, but it's many. And those are being watched in a center in lower Manhattan, the name of which I can't exactly recall, but it's run by the PD. Lower Manhattan something or other. And so those cameras are on, and they're obviously able not to watch all of them, but that feed is being taken. Those cameras are also programmed to alert when certain events happen. Someone leaves a package in the scope of the camera and just leaves the package there. That will trigger an alert and bring someone from the PD to then either respond or take a deeper look. And those cameras are searchable. I don't know how they're searchable, but they are searchable, such that if you're looking for man in red shirt, the software can actually go back through the digital footage and put in front of you men in red shirt in the location. So that's, the police are looking at those. So many buildings now have, and premises have private cameras and video cameras. So I don't know if anyone's really looking at that video, but I will tell you that that so much of the work that we end up doing relies upon our ability to recreate what happened at a place at nighttime. And so cameras at locations in northern Manhattan and southern Manhattan are actually really important for us. So if I were to weigh the fact that if I'm being watched while I'm outside, I don't like that. On the other hand, if I get mugged while I'm outside, I really do want somebody watching. And our office is very fortunate to have done some very large financial cases and enabled us to accumulate through forfeitures a lot of money. And we've given $100 million to NYCHA, our office. The purpose of that money is to provide cameras at 15 NYCHA developments all through the city, lighting, as well as layered access. So mental health, and mental health is also very related to feeling safer. And so the degree to which we can enhance the feeling of safety in our neighborhoods, not just by enforcement, but also by preventative measures. You want to get rid of the shadows outside of a building, because that's going to minimize the chance that gangs who are looking to stack up against each other are going to be doing that in your neighborhood.
So aren't those the 15 developments that have the highest crime? Because they're not all of them. They're not on mine.
No, yes, it's the highest crime, and that's how we decided to give out the money. 6%, Carmen, or 5% of our city's population lives in NYCHA. About 26% of the violent crime occurs in the developments. So this is, if you're going to pick a place to invest in crime fighting and crime preventive measures, the developments are a place to pick.
I have another DA question,
Yeah,
but
sorry.
you want to?
I just wanted to comment briefly. The question kind of brought it up. I have a personal relationship to those cameras and to those surveillance cameras. In 2013, in the neighborhood, I was attacked by about 20 to 30 men. My jaw was fractured, and it was caught on those cameras. I was in the news.
Yeah, that's why I know you're fine. I knew your face was familiar. I watch I'm a news hog. I watch everything.
And I think there's a few things that I take away from that. One is, first of all, I got to know a lot of people on this on this stage through that incident. In part because it really, in some ways, showed me how a community can take care of a doctor. And in a specific way. One is that I had a number of people that actually intervened at that time. Cameras can't intervene, but cameras later on can give you some sense of what to do and where to go. But at the same time, I think what it did for me is it really transformed my own understanding of all these organizations and people. People hug me on the street afterwards. I had a patient that I went to the hospital to go working a couple of days afterwards, just because there was so much press attention. And there's a woman who came in with a serious lung infection. And I had asked her, how is she doing? And she ripped off her mask and she said, "How are you doing, Dr. Singh?" I think what that said to me is that there's a lot of different types of eyes that are watching.
Yeah.
There's, cameras are part of the infrastructure of how we in a modern day look at keeping our neighborhoods safe, but how we design the physical infrastructure of our neighborhoods, how we think about all the new housing that's coming together, who are the friendly eyes, the warm eyes, who that can actually see things, go outside and do things and change that landscape. I think that's in many ways, there's kind of hard elements of safety that we need to install, but there's kind of community, cultural, design elements of what does it mean to feel safer inside that some of those things can't be installed. So you're looking at a multiple set of methods to create a feeling of safety and warmth in a place.
So this is related to safety. One of the first things that everyone talked about is a lack of trust between citizens and the police. Can you talk about how that can be addressed?
Me?
Yes.
I think it needs to be addressed by having a completely undefensive, open conversation. Period, full stop. And the ways that, I'll give you examples in my office about how I think I've tried to address it. One of the first things I did when I became DA was I sought out the Vera Institute of Justice, which is a nationally known bipartisan think tank that deals with criminal justice, and it's a phenomenal organization based here in Manhattan. And I asked Mike Jacobson, who was then the head of it, to come in and do a racial bias review of the Manhattan DA's office. And that was to look at our hundreds of thousands of cases and try to identify whether, looking at those records and interviews, he could tell me, were we treating people of different colors and different backgrounds differently? And it took about 2.5 to 3 years because they looked at hundreds of thousands of files and the like. And that was sort of step number one, which is not to be afraid of what the answer might be. The bigger thing to be afraid of is not trying to find out what the problem is. And so for our organization, I do not believe the district attorneys in my office are consciously biased. And yet we all carry biases of some kind in us. And the trick, I think, is to become aware of that fact and not be defensive, but try to then understand how to check those biases in the way that we do our job. So one example is we just need to deal with it. And there is a feeling that the justice system is racially biased. You don't have to go far, but look in the courtroom, where 90% of the people in the courtroom who are accused are young men and women of color. So we need to just, the kind of talents and disciplines that are here right now, we all are really responsible for our piece of that. Where is the education? Where is the appropriate housing? Where are the job opportunities? I mean, those are things that cause criminality. And then how are we as prosecutors respecting, dealing with the victim community? And how are the police officers dealing with the victim community? And I think the police have gone a long way, although there is obviously still a long way to go. They've gone a long way in terms of their willingness to understand there is a problem and we have to deal with it.
Just share about maybe 4 years ago now, right? So Strive's offices are on the 3rd floor of this building, and they look out on 2nd Avenue between 124th and 123rd Street. And so there are a lot of young kids out there slinging. there's a mini precinct across the street from Strive, and one time they requested a meeting, people from the precinct requested a meeting with me. And the purpose of the meeting was
Hey,
to
Rob,
ask-
you want to let everybody what slinging is?
You want
selling drugs. I'm sorry.
said
Slinging. They wanted to use Strive as a lookout to, observe the guys make arrests. And I told them I couldn't do that. And they were a bit, let's say, perturbed. I was going to use the word salty, but then I'd have to explain what salty means, right? And I said to them, nothing against you. We both service the community in different ways. Because of my own background, I still have like a connection to those young boys that are out there doing that kind of stuff, and it's really kind of hard to break. Because I know that people don't just wake up and say, I want to be the best dope dealer on the block. There's a series of things that happens to get us there. But what I did advise them is that, if they could begin to come to Strive and hold kind of talk sessions with some of our young men and young women to a lesser extent, that would begin to repair, that damage. The other thing I did, right, is I went down to the young men and I said, look, this is what's going on. So, you could come up and get services for a job, but if you're going to, sling here, understand what's getting ready to come your way. And of course, they call me OG and thanks a lot and all that kind of stuff. My thing wasn't to create a safe space for them. It was to get them to understand that what they're doing was time limited. Yeah. All right? There's a saying in the hood, I don't know any old hustlers because either they don't make it or they're locked up. Those that were smart enough cleaned their money up and got out of it or what have you. But clearly, we service the communities in different ways. Now, as a 64-year-old, getting ready to be a 65-year-old black man who wears suits and ties, drives a nice car, I must say that the challenge I still have is, if a cop car pulls behind me, I get the black guy shakes. That's also part of what the challenge that we go through. So our community's dilemma is that at the same time, they might not, and this is not across the board, where there might not be trust. On the other hand, if they was to tell the project, we're pulling all the cops out,
we're not
we would
projects,
freak
we're
out.
housing development.
Like, oh, I'm sorry. I grew up in the project. Now it's housing development. Okay, I gotta change my manner of speaking. But my point is that at the same time that there's this lack of trust, they also want that presence in that community. They want that relationship to be developed with law enforcement. So that's, as I put it, we just got to jump in and deal with it because it's not something that's just going to go away like smoke.
Thank you. We have time for one more question.
Can I piggyback
Yes, you
off
can.
of that for a
Yes,
minute?
you can.
Because this is a real issue. I mean, I deal with kids every day, all day long, and like you, I'm in the hood too. I know how to get street too. We all been there, but our kids are literally afraid. The other day, my grandson had came to my house. He's 13 years old, Clyde. He's tall as a tree. He came to my house. He says, "Well, Grandma, I'm going to a basketball game. All right, I'm going." 30 minutes later, he had gotten stopped on his way to the basketball game. He got stopped, and all he said was, "My grandmother's Carmen Quinones. Can I call her?" And they told him no. Okay, they kept him there for about a half hour without letting him make a call. Now, I say this to say, you teach your children, right, that if a cop stops you, right, you don't give him no lip. You just say, "I'm okay. Listen, can I have a call?" That's what I tell them to say all the time. But and see, for a 13-year-old, that's almost like a dilemma for them. It's like, "Dad, Grandma, I wasn't doing nothing. I was just going to play basketball." when we want to communicate, and I think a lot of the community, especially NYCHA developments, there is a sense of course, we want to communicate with our police officers. By the way, we got very good police officers. I love my PSA 6 officers. My community cop officers are very good. I make sure that I invite them, but there is a problem, and it continues. This just happened last week. It continues that when you see a kid with 2 or 3, you gotta stop them, and that's it's sad because most of our young people are really trying to do good things, and when they're faced with that, it just. I mean, what else can we do? I mean, if a child says, "Let me call my grandmother," can he call his grandmother? Why not?
So we're almost out of time, but this question relates, and it's about how wonderful it is to have all of you here who would not necessarily be in the same conversation in your daily lives, wherever they are, and a question about how this can translate into life for people. And Clyde, in particular, if you want to start, how policy can have an influence on this.
Well, again, I've been very fortunate in my life to have the ability to work on public policy. And I know that public policy can have a profound impact on helping to change the lives of people. As I said earlier, you look at the Affordable Health Care Act, what it did. I think about Medicare and Medicaid. Years ago when those things were passed, people said they were socialist programs. And you try to take an old person's Medicare away or Medicaid away now, they'll kill you. I mean, it's a very different dynamic. You start to think about all the things when I was Deputy Chief of Staff at Department of Agriculture, the food stamp program, the WIC program, the National School Lunch Program that feeds more people every single day than any other program in this country. These things are real, and these are the kind of programs we need. And when I started to look at where we're heading as a country in reference to public policy, I feel like we're heading in the wrong direction. And one of the things I don't like to do is be partisan on something like this, but I look at Republicans when they took over the House. The Farm Bill used to be directly associated with food feeding programs. They were connected. They were connected under Republicans and Democrats alike. That was the thing. Nobody would touch one without the other. Republicans in the House decided to separate them. The Farm Bill now, for those who are farmers who want to get crop insurance, who get other subsidies not to grow things, they're fine. But yet, programs that actually feed people have been decimated. To give you an example, one program just here in New York, the food pantry program has been cut significantly. And it's interesting, I went with a reporter from the New York Times and did a walkthrough last Friday. And we came to Douglas Housing and saw Carmen also. And you go in these food pantries and you see how many people are there. We were talking to the people who were telling us that they used to just see seniors and they would see homeless people. Now they're seeing entire families. That is not what good, sound public policy should be about. That's what we should not be about as a country. And so we have an obligation, I believe, to change that trajectory, was doing the best interests of people all across this country to make certain that we take care of people who cannot take care of themselves and stop penalizing people for being poor.
Exactly.
Anybody else want? I don't want to.
I'll jump
Yeah,
in.
yeah.
Now, Clyde told me I shouldn't say this, but I'm going to say it anyway. So I look at, I'm in the jobs business, right? Or was in the jobs business. I stepped away from Strive and started a consulting firm. So I've been working 38 years, right? When I transitioned out of Strive, and I still do consulting for them, but I went from going into the city, because I live in Teaneck over there, New Jersey, 5 days a week to maybe 3. Just the fact that I wasn't moving for another 2 days and staying home and working from home, I put on 10 pounds. That can't be good, right? Just the notion of having somewhere to get up and go to every day and move around is a health issue, right? As a workforce person, it's also my responsibility to look at trends. Most of the individuals the overwhelming majority of the people we work with are not college graduates. You know, some may be high school dropouts, got a GED or what have you, but they're sharp folks. And I look at job opportunities that are going to pay them a living wage. I mean, a wage that they can actually feed their kids with. Because of the Affordable Care Act and the work that people like Prob are doing, and strengthen that interface between the hospital and the hood, so to speak, there is, I think, a career track for young men and women of any ethnic group, but particularly young men and women of color, to go in there and get training to be the eyes and ears and do something very simple, like it might be, well, I know this is impossible now, the 27-year-old Rob to knock on the door of my abuela, my grandmother, and make sure she took her high blood pressure medication. There are simple tweaks we can do. And community health workers, I think, is the front lines of that. And the young men and women we train, we'd like to see them heavily involved with that. And I'll just leave it with one thing, and Desai and I were talking about this earlier. One can assume that the Psy or the Rob or the Clyde or the Prob or the Common that's working is healthier than the one that's not. Just by simple, I get up and have somewhere to go every day. Because what we forget to realize is the most important value of work, everybody thinks it's money. No, work is an organizing principle in one's life. There's something about having to be at the same place at the same time every day that imposes order and discipline on the individual, which also impacts their health.
Either anybody have anything else?
What I really want to say is, first of all, I want to thank Clyde, for coming in and bringing this mapping to me. But what I want to say is that we're talking about health, but health has to do with getting a good meal in the morning. Health has to do with someone having some place to sleep. So when we want to tie everything together to health, everything you do is about health. Because if a kid doesn't have a plate of food in the morning, he cannot learn because he won't be able to concentrate. We are facing so many different things, and it's all about health. We have people literally hungry every day. And Clyde came to Douglas, and you should have seen all the people I had to turn away because we didn't have the food for them. This is a big issue. We have homelessness. We have people that have nowhere to live. And kids living in shelters. And they're still trying to go to school. That's why I say the health field has to make sure that when they serve you, they serve all of you, mentally and physically. That's what I'm talking about.
I think just actually to really build on that, which is beautifully said, Carmen. I remember when I was in medical school, there's truly are men often with red bow ties. You've seen on TV or otherwise, red bow tie that would give you they'd call them pearls. It was just like that. Pearls of wisdom. And it's an old saying in medicine that you have to listen to the patient because they will tell you the diagnosis. And it's kind of a little bit of a profound thing in there. And I think in some ways, medicine as a system, instead of at the doctor level, but at a system level, is starting to ask itself, if you listen to a community, it'll tell you what it needs. And that really echoes what you've said, Carmen. And so what does that mean practically? It means practically, even today, as I was reviewing some of our workflows internally, it means that the type of questions that we ask people, are you hungry? Do you feel safe? Do you feel like you have some place to go after this visit? Those become primary questions in how a health system interacts with the community to make sure that it is healthy. And that's something that we're starting to do now. And the third element is that it's not simply a matter of a transaction happening in between a healthcare system and a community. It's what Rob mentioned and what Clyde has helped me set up over the last 3 years, is ways to actually involve people in the work, that organizing principle, which makes part of your work to make a healthier neighborhood through community health workers or otherwise. So you've got to listen, you've got to actually start asking the right questions, and then you've got to actually change the work. And until we start doing those three things, we'll still see this amazing kind of disconnect. But I think that these sort of conversations, the listening part, the mapping part, is starting to at least get into step one and move us down that path.
You have anything you want to add? Because
I'd like to get together with these guys again.
okay, we'll do that. This has been really extraordinary. Thank you all for coming, and thank you all for coming.
Thank you.
I think the question is, do we value the individual? Because if we don't value the individual, then we're not going to help that person. If you don't value the individual, that's why the kids are in prison and they're in solitary confinement at age 16 and 17 and waiting for a date in court. Those are just reality of the situation. And people of color is not the term that should be. They're human beings, and there are distinct cultural norms that affects African Americans, that affects no other group in this country because of the history. And there are groups, information that affects Hispanic population and Indian population and all other groups. But for the African American population, the elephant in the room is that we have the worst health outcomes, and the question is why? And it comes down to value of patient. Stop and frisk, when they stopped it and they looked at the data for stop and frisk, less than 10% of the people that they stopped, they had any reason to stop them for, and 600 and something thousand get stopped. The kids that are in prison, yes, economics play a role, don't get me wrong, and I applaud Carmen who spoke about some of the issues. But the issue right now is how are we going to improve the health of the most vulnerable population. And just another note, the sickle cell patients who are black, and they have disease from birth, and we have the audacity, the unmitigated gall to call them drug seekers when they get to the adult world. And they have, because they say, tell me, put the IV here, give me the medication that I need. So you have an educated patient who adolescent docs have told them what to do, and when they get to the adult world, they're drug seekers. So we got to have a different conversation, a more honest conversation about where we are with the health. Food, absolutely important. The elderly black patients who said my parents were a step away from slavery and my grandparents were slaves, and I don't trust you doctors, and I picked cotton in the South all my life, and I don't deserve to be treated that way. That's the cultural stuff that we have to address. Thank you very much.
I just want to echo that in part because what you're saying, bears out very clearly in the data or in the evidence. And I think as Sai mentioned about starting to be open to looking at the information and not being afraid of what's there, that spirit, I think, is starting to grow in a lot of our work. We know, for example, that actually there are biases. There are, first of all, real disparities in health, and then there's also real biases in treatment. And over the last 20 years, we found that those things, for example, heart attack rates were much, much worse 15 years ago in African American males and females. Same thing with cancer rates. And when we start to really focus on that, we address the fact that there genuinely are unconscious and conscious biases in how treatment is done. Those actually have started to close very quickly. The question is, are we measuring the things that people value? And that there are still disconnects there. I'll give you one example of the pioneering work of which there are dozens of examples that have come out of Harlem, the community itself. We've mentioned community health workers, which are kind of worldwide phenomenon, and patient navigators in particular. There's a doctor named Harold Freeman. I'm not sure if you know him. He was a breast cancer surgeon. He was trained at Memorial Sloan Kettering. His cousin was Robert Weaver, the first secretary of African American secretary of in the cabinet. He could have gone anywhere. He came to Harlem Hospital to train. He came in there with fancy technology and skills, and he found that all the African American women who were coming to see him were coming with such late stage breast cancer that all of his surgery just didn't matter. So he kind of dropped what he was doing in the operating room, and he started going out and actually training people to be navigators so that you didn't wait too long between steps, which is where all the real kind of disparities start to really add up. And I think the key insight for me, especially when I listened to Harold talk about his story and his approach, is that he had the rapport with that community to go in and talk to people, and he had the insight that that's the right thing to do or the right work to do. And so in some ways, these disparities are real. They don't close even just by showing the numbers. They require you to actually go out and do things differently, and that's what I think doing work differently is central to all of this. So it's not as a response to say, hey, things are getting better. There's some things that are, but there's a lot of things that aren't, a lot of things that we aren't valuing or measuring well. But there's a question of, is there the rapport and is there the interest to actually start to do work differently?
I agree with you totally. And I think that there's a lot to be done. And I think that's why we're here. We're trying to make a step in that right direction. I sit on the patient advisory board in Metropolitan. And what I do sometimes, I go there in my jeans and my cap, looking all, street. And I sit in the emergency room and I watch what goes on. And I do my little investigation, and I think that we all need to do that. If you have a hospital in there and you think, you need to go and find out what's happening. And I think it's going to take all of us because these problems are really big. I didn't tell Vance what happened to my grandson because I wanted to attack him. I wanted to tell him that even we that address these issues with our grandchildren and tell our grandchildren, this is how you do it. And then when you do that and they still, are harassed, then that's a problem. Because if you're asking me to each one teach one, then you each one teach one too. And it's a society thing where we all have to put our input in it. Everybody. This is not a one-sided issue. It's not a black. This is a human issue, humanity issue. We are human. We are a human race. We are not black, white, Puerto Rican. No, we're human. And so when we sit with our doctors and we sit with these people, they need to look at us for what we are: human, not black, not white, not Puerto Rican.
Thank you. My name is.
I think we have we have time for one more question.
I'll be very quick. My name is Thomas Lopez Pierre, and I'm a candidate for City Council in Upper Manhattan. And I was born addicted to heroin, foster care, group home, public school. My brother died from lead poisoning. I think it was 8 bullets. No, it was 9 bullets. And like so many young black men, they die before the age of 30. That's the #1 health problem for young black men is homicide. Not arthritis, not diabetes, it's homicide. So my question is for the Manhattan DA, is that I fear that when I'm the mayor of New York City in a number of years, that I'll be sitting, God willing, I'll be sitting on a panel talking about the fact that so many young black men are dying. And I think you're doing an excellent job going after the gangs in those developments that are in the council district I seek to represent. However, I feel that these young men are not bad because they have lack of values. Poverty is the primary cause of their behavior. So I believe that unless we deal with the issue of poverty, you're going to be in a growth business. And that's the fear.
I'm trying to get run out of business. Clearly, nothing would make us happier. But I think all I can say is what you say is obviously right. And I think I alluded to it earlier. By the time I get involved, it's typically late, which is why we are spending so much more time. For every hour that we work in the courtroom, I want us to have 2 hours of work in the community to prevent people from being victimized. But so we have a part to play. But the people who I think have to step up and answer your question are governors, presidents, senators, congressmen and women who are dealing with education, housing, employment. And I'll play my part, and I probably could play a better one than I am now, but what I'm doing is on the margins.
And you're doing a good job. I love you, honey.
Thanks again, everybody. Thank you all.
Feeling well. So it is our job to make them feel a lot better. I represent almost 300,000 people sitting on the board, and these are all NYCHA developments. So as you know, we have a lot of issues in NYCHA. So I don't want to take too much time with that, but there's a lot to be said.
All right, Prabhat?
Great, thanks, Carmen. Thanks, Cheryl. So my name is Prabhat Singh. I'm a primary care physician, and I work here I work in Harlem in New York City. I recently joined Mount Sinai Health System after being at Columbia University for about 4 years at the International Affairs School, where I thought more about global issues in health and healthcare. And after living for 4 years in Harlem as I trained to be a primary care doctor, it really became evident to me that I needed to shift my work and recognize that that global that I was looking for was actually here in our own communities. Over the last 4 years, I've learned an immense amount working with community health workers, people from the community who are trained to motivate the people around them, to help improve their ability to set goals and achieve them in ways that improve their health, improve their life. And in many ways, I learned that there's a two-way street between how healthcare is designed and delivered from the perspective of a physician and how it's received and interpreted on the side of my neighbors in Harlem. And through that process, as I started to shift to Mount Sinai Health System, in the context of a unprecedented dynamic healthcare environment, where in New York State alone, the state is spending $8 billion to redesign how it cares for low-income New Yorkers, in participation with about 200 community organizations in Upper Manhattan and across the city. I realized that we really needed a way to make sure that this input and the perspective that you see when you talk to a patient, when you speak with your neighbor, doesn't stay just in their minds. We actually find ways to scale that up so that there's actually a design interaction that helps us think together in more constructive ways about how do we build.
Advisor at the Peterson Center for Healthcare. He was the founding technical advisor of City HealthWorks, which is a Harlem-based social enterprise that trains and manages locally hired health coaches to improve the outcomes for high-need patients. Cyrus Vance Jr. is a Manhattan native. He was inaugurated as the District Attorney of New York County in 2010 and re-elected in 2013. He's enhanced the expertise of the DA's office on identity theft, cybercrime, white-collar fraud, hate crimes, terrorism, domestic violence, human trafficking, and violent and gang-related crimes. And Clyde Williams has had a long career in public service that includes working for both Presidents Clinton and Obama, creating public-private partnerships in Harlem and nationally, and federal housing and food programs that affect urban communities. Clyde is a board member of the MAC AIDS Fund for programs that reduce HIV infection in Harlem. So for all of the thousands of hours of work, I want to thank our team at DSI and our faculty and students, and Gabe Schuster, who was our cartographer, Kevin O'Callahan, who designed the exhibit, Primoz Kovacic, who flew all the way from Nairobi, Kenya to conduct the master classes, Larry Jackson from Strive, and most of all, my decade-long collaborator and dear friend, Letha Filderman, who's the president of PopTech. So now, please welcome our speakers, and we will all come together on the other side of the stage.
We're all excited to have a group as diverse in perspective and experience as this one. So I would love to ask each of you to talk about your particular definition of health and your perspective on what community health is. And we're going to start with ladies first.
I'm always put on the spot. See that? The only lady here?
Hey, hey.
All right. My name is Carmen Quinones. Health is a big issue here in the city. I sit on Metropolitan's board for the auxiliary and patient advisory board. And so we know that when people come into the hospital, they already come with anxiety because they're not.
Welcome, everybody. Thank you all for coming. I'm Cheryl Heller, Chair of Design for Social Innovation at SVA. And we are the first MFA program in social impact design, which is the application of the design methodology to creating a healthy society and the environment. As a graduate program, we engage in lots of projects with communities and institutions to benefit them and also to expose students to the world as it is in real life. And that desire to work with communities was the genesis of this initiative. Systemic social issues aren't ever solved by a single institution or industry. They require collaboration. Our collaborators on this project are the Arnhold Institute for Global Health at the Icahn School of Medicine at Mount Sinai. They are working to improve the health of people around the world by building global partnerships in research, education, and patient care. The PopTech Institute, an organization that convenes and catalyzes an extraordinary global network of scientists, technologists, and thinkers to collaborate on groundbreaking projects in global health, human rights, and violence prevention. And Strive, an organization founded in East Harlem that now provides services that help people in many cities find sustained employment and become valuable contributors to their families, employers, and communities. So that's who we are, and I'm going to now attempt a 1-minute history of the months of work and events that brought us here tonight. It began with a class of our first-year students, all of whom are here, who come from 13 different countries, who went out to map 4 blocks in Harlem and identify what they thought might be the forces that impact health. And then a group of Harlem residents who mapped what they saw and felt from the inside. With help, the students turned their data into an interactive gallery exhibit that illustrated various categories of the data collected, like green spaces on the left, all the services available in the neighborhood, all the signs and visual communication that residents encounter, and noise pollution, and there were others. We had a reception where lots of people came to see the show. And we combined student and resident data with public data. We built a workroom to display them so people could come and discuss what they saw. We made a lot of digital maps for the purpose of illuminating data and starting conversations about the implications of what we found. This one is on housing. We did them on what fresh food was available, health services, and lots of other things. We invited a small group of designers and mappers and residents to discuss what we found so far and what they thought was missing. And last Thursday, we offered a masterclass in Harlem to teach residents the skills to develop their own data, to have their own voice, and participate in solutions. All of which brings us to tonight. This is the culmination of what we hope is the beginning of something much longer. It's nothing compared to what needs to be done, But we're committed to continue long after this evening and beyond this small group of collaborators to help the residents of Harlem live in neighborhoods that actually promote health. I learned just this morning that Langston Hughes was born on this very day 112 years ago. Obviously one of the great American poets. And so I thought it would be fitting to read his very short poem called Harlem. What happens to a dream deferred? Does it dry up like a raisin in the sun, or fester like a sore and then run? Does it stink like rotten meat, or crust and sugar over like a syrupy sweet? Maybe it just sags like a heavy load, or does it explode? So I'm extremely honored and excited to introduce our speakers this evening, who are going to talk about how we might create a healthier Harlem. And just to say in advance, the issues that we're going to be discussing are those that have emerged from all the conversations we've had with Harlem residents so far. Rob Carmona is one of the co-founders of Strive International. From its beginnings in an East Harlem basement office in 1984, the Strive model has grown to over 20 cities nationwide and overseas, and has helped over 50,000 individuals enter the workforce. East Harlem-born Carmen Quinones is Tenants Association president for the Frederick Douglass Houses. She's on the Manhattan staff of presidents, which represents 28 housing projects and 300,000 people. Dr. Prabhat Singh is director of the Arnhold Institute for Global Health and special...
Not health care systems, but healthy communities. And in many ways, that means that even as a technical expert, we have to kind of recognize that we have limits, and a lot of the people around us have those solutions. It's both a really exciting place to be. It's also incredibly humbling, in part because, as Cheryl mentioned, there's no industry that's able to solve complex social challenges alone. And as I look to my colleagues that lead housing institutions or lead institutions that are at the head of the safety of of New Yorkers, I think every one of us grapples with the fact that you can't do this alone. And so we're always looking for ways to design better and to design in larger foras. And it's been incredibly exciting, and it's been really fortunate for us over the last year and a few years to start to learn the methods to give voice to start a map, and start to interact at a much more constructive level with the communities that we say that we're serving.
Good evening. My name is Clyde Williams, and I'm glad to be here, and thank you guys for organizing this event. When I think about healthcare, I think about something my grandmother used to say to me all the time, that you don't even think about your health until you have to think about your health. And when I think about what healthcare means, to me, it was always something I thought about as a national issue. As a person who had the ability to work for President Clinton and for President Obama, I was one of the people who went across this country pushing the healthcare initiative program that was institutionalized by this president that we have now, Obama. The Affordable Health Care Act is a tremendous piece of legislation when you think about it. Every president since Teddy Roosevelt has tried to do something around health care, and he is the only person who got something done. When I think about health care, I think about the fact that millions of people now have health care who didn't have it before. I think about the fact that people who are 27 and younger can stay on their parents' health care policy for years now when they couldn't do so before. But I also think about how it changes us as a society. I think about healthcare as being a national security issue. Without having a healthy group of people, an educated group of people, we cannot be competitive with the rest of the world, and it's something we need to be aware of. When I think about healthcare, I think about Harlem specifically because I live there, because I'm raising my children there. I think about the fact that 30% of the people that live in that congressional district live at or below the poverty level. I think about the fact that every single day there are people all across that district who are worried about health care issues, particularly mental health care issues, which